Hello everyone, it's Dr. Gupta, dermatologist here in Cincinnati, and we are discussing Botox myths. Botox myth number one is that Botox is for older people. So Botox can actually be used in any age group, and sometimes it's even used in babies or in pediatric situations where patients may have contractions that need to be released and relaxed. It's also used for medicinal purposes in other specialties as well. But in aesthetics, we use Botox in patients who are as young as 10 to 12 years of age and even older. In our younger population, sometimes we're using it for hyperhidrosis or to get rid of excess sweating. And as one ages, you may still have hyperhidrosis or trapezius muscle tension or TMJ or migraines. And we use Botox for all of these indications regularly in all age groups. Botox is not just for patients who are older in terms of wrinkle reduction. You can start this at any age when you start to notice that certain movements are creating wrinkles, and those wrinkles may start to be visible even when you are not making that expression, or if you don't like a particular expression because you're worried it may lead to wrinkles, we can relax those movements earlier on so that it gets you out of the habit of making those movements and also prevents those wrinkles and lines from etching into your skin. Myth number two, Botox will make you look frozen or unnatural. So I will say that this is a procedure where we want to really place it in a scientific way to where it really helps to relax the muscles that are actually making movements and leave other muscle groups alone. And we may need to counter certain movements with one another, so it does become a bit of an art as well as a science in figuring out how to place it. And if we do that correctly and we're able to accomplish that, then no, Botox does not look frozen. It does not make you look unnatural. That's not the goal, in fact. And sometimes patients want like absolutely zero movement, and that's fine because some patients prefer that, but really I prefer placing it a little bit more naturally so you still have a bit of movement, which is okay and natural. The main purpose of Botox is not to eliminate movement but to prevent wrinkling. So as long as the movement is not strong enough to where it's creating the wrinkle, you can still look very natural and very nice. Myth number three, Botox is painful. So this is a personal, I guess, sort of opinion that you will have, but unfortunately at this point we're still using needles to inject the Botox. The needles are very, very small, so if you're familiar with gauges, we usually use anywhere from 30 gauge to 32 gauge needles, which are extremely tiny, and honestly you can hardly feel them. And in my hands, patients always tell me that I'm gentler than other injectors they've had. So is it painful? Not really. I think it's quite tolerable. Myth number four, Botox is only for women. Botox is for men and women. There is a term called Botox, if you have not heard of it, but that has become quite popular for men who get it. And absolutely, men and women both benefit from Botox. In men, we administer it a little bit differently because we want them to maintain a masculine look and not feminize their face. But absolutely, men and women. Myth number five, Botox is dangerous. Now, if you have certain neurological conditions or an allergic reaction to an ingredient that would be in the product, or if you have some sort of an autoimmune disease that would preclude you from getting Botox, then it would not be for you. But otherwise, Botox is actually a very safe product. It has been in use for at least 2 to 3 decades at this point. And again, it started for use for medicinal purposes. And when used in small quantities, it is certainly not dangerous. It is not going to cause botulism. For that, you would need mega doses that would be injected directly into your vessels. Of course, we are always cautious when we're dealing with a medical product, but certainly the safety of Botox has been long proven and very good.